Governor Bill Lee is set to sign a bill that would allow Tennessee pharmacists to fill prescriptions for the anti-parasitic drug Ivermectin for human use. The House approved the bill yesterday. Controversy surrounds this drug. Some say it's been misused throughout the pandemic. Our Elise Wick has more.
Yes, Cindy, ivermectin has been used to treat extreme cases of scabies or lice infestation in the past. It's been considered to be safe and an effective drug for parasitic infections. It's affordable and well established, but doses to treat those problems are agreed upon within the medical community. For COVID-19 treatment, it's still a question of, is it a useful dose? And controversy and confusion around the formula that also treats parasites in livestock.
So early in the pandemic, we had nothing specific to treat COVID-19. We still have a very limited arsenal, as most people might be aware, but we had nothing that was specific. So people decided to look what we have that can do anything.
Dr. Carlos Baliero, the medical director of pulmonary medicine at CHI Memorial, says now with more knowledge and case studies of ivermectin used to treat COVID-19, it is not as impactful as once thought to be.
There's a newest study that was just published online at the New England Journal of Medicine, which is a very reputable journal, just now at the end of March. It's from Brazil, and it's the largest controlled trial. They took patients who were diagnosed with COVID, and they gave some a placebo, so a control medication, and some got ivermectin, and there was no benefit. There was no advantage. They even mentioned on some of their discussion they could not see any advantage.
With the bill on the table to allow Tennessee pharmacists to fill these prescriptions without repercussions, Dr. Baliero says it's important to figure out the right dosage, and that could be a challenge to pharmacists.
So it puts the pharmacists in the predicament of trying to navigate what dosage would they recommend. And some people may look it up online and come in with an idea of the dosage that they want. But that, again, is an off-label indication that doesn't have an approved dosage.
He says there was an increase in calls to poison control over the misuse of the drug.
But they went from never having any calls about ivermectin to having handfuls here and there. And a lot of those, again, were related to neurologic side effects.
Medical professionals say the data they have reviewed shows that vaccines are still the best protection and prevention against COVID-19. Reporting live in the studio, Elise Zwick, Local 3 News.